I'm Emily.
I'm Caitlin.
I'm Kelly.
I'm Stephanie.
I'm Christy. This is my visual aid. And my note cards. In the last 10 years, I've spent my free time trying to help other addicts like myself recover from their addiction. Addiction is a disease just like cancer and diabetes and should be treated as such. The problem is that drug addicts cause so much destruction and damage in the lives of the people around them that the general public believes that they should be punished and have consequences. I also believe that everyone should face the consequences of their actions, but I have seen firsthand that if we do not resolve the issue and treat the addiction, then it's just a vicious cycle that doesn't end. Today, I'm here to persuade you to support drug addiction treatment reform because drug addicts are dying every day, our jails are overpopulated, and there are treatment plans that have proved to be successful in helping addicts become productive members of society. We will begin by taking a look at the number of lives that have been lost to drug overdoses. Drug overdoses have risen in alarming rates over the last 10 years in the United States. As shown in my first graph, heroin overdoses have risen from about 2,000 people in 2001 to over 10,000 people in 2014. According to the National Institute of Drug Abuse. Also by 2014, the number of prescription drug overdoses has risen to over 25,000 deaths. The Maryland Department of Health and Mental Hygiene states that in Maryland alone, the overdose rates have been steadily growing for the last 5 years. Heroin overdoses have more than doubled, with 748 people dying in 2015. And fentanyl deaths have rose an alarming rate from 26 people in 2007 to 340 people in 2015. Next, we will discuss the people who have been incarcerated due to drug-related crimes. Our prisons are overpopulated with drug offenders, and it is costing the United States billions of dollars a year. The National Institute on Drug Abuse estimates that the cost to society for drug-related crimes is over $113 billion a year. In Baltimore, the cost of incarcerating a drug addict in 2014 was over $21,000 more than treatment would have been for a drug addict in that year, according to the Baltimore Behavioral Health. The Federal Bureau of Prisons states that 46% of the prison population are incarcerated for drug crimes in the United States. Many of other states have been turning to drug court as an alternative to prison, as discussed in the book Judging Addicts, Drug Court and Coercion in the Justice System by Rebecca Tiger. It is argued that punishment through the court system in conjunction with treatment of the disease will enhance the effectiveness of the treatment of the drug addict. In the Problem-Solving Court's annual report from the Maryland courts, it states more than half of the adults who entered into the drug court program successfully completed that program. This means that they completed a treatment program created for them for their drug addiction. Finally, we will review options for drug addiction, treatment options for drug addiction. There are several options that have proved to be effective in allowing drug addicts to become productive members of society again. Joni Gamil tells us that there are multiple medications available that can be used for opiate addicts in her book, Painkillers, Heroin, and the Road to Sanity. Buprenorphine works by binding tightly to opiate receptors in the brain, which allows for the effects of other opiates to not be felt by the person taking this medication. Suboxone is a combination of buprenorphine and naltrexone, which is easier to prescribe to patients because it is less regulated. And the naltrexone in the medication will cause severe withdrawal symptoms if the person tries to misuse it by crushing the Suboxone. Methadone is a opiate blocker that can only be obtained through clinics that monitor the use of the medication. 12-step programs have had success in helping addicts achieve and maintain sobriety, as discussed in Prescription Painkillers by Marvin Seppala. The 12-step program is a voluntary support group that help each other deal with their shared drug problem. Many anonymous groups have been formed, but the two most popular are Narcotics Anonymous and Alcoholics Anonymous. In Narcotics Anonymous, the primary therapeutic value stems from addicts helping other addicts and recognition that addiction is a relapsing illness requiring total abstinence. You can help bring about change just by making sure the people in your life are properly informed. Talk to friends, children, parents, neighbors, and peers. The first step towards reforming how drug addiction is treated in the United States is to educate the public. Addiction is a disease. It is not a moral deficiency. In conclusion, once we see drug addiction for what it is, a disease, we can begin to handle this epidemic appropriately. Treatment of drug addiction is a much better option, not only for the drug addict, but also for society and our country's finances. It's better than just simply throwing addicts in jail. We need to reform our treatment of drug addiction because addicts are dying every day, our jails are overpopulated, and there are treatment plans available that have had success in helping addicts become productive members of society. Russell Brand said, "The mentality and behavior of drug addicts and alcoholics is wholly irrational until you understand that they are completely powerless over their addiction, and unless they have support, unless they have structured help, they have no hope."